Cardiovascular disease in the American Indian population. Also known as heart disease, cardiovascular disease affects the heart and blood vessels and can cause a variety of conditions such as atherosclerosis, heart attacks, heart failure, arrhythmia, and heart valve problems. Some heart disease is genetic, but lifestyle choices play a key role in cardiovascular disease as well. Taking a look into various cultures can help us to understand why these diseases affect a specific population and help us to address these issues among them. Risk factors for cardiovascular disease include smoking, high blood pressure and cholesterol, diabetes, being overweight or obese, having a poor diet, being physically inactive, and consuming an excess amount of alcohol. Cardiovascular disease is the leading cause of death in the United States, causing 1 out of every 4 deaths. Annually, this costs the United States over $200 billion. This cost accounts for all medical expenses, including doctor's visits, prescriptions, and loss in productivity. This map shows us the heart disease death rates between 2008 and 2010 within the United States of adults over 35 years of age. Over the past several decades, there has been a significant shift in the health of American Indian population. In the past, infectious disease was the main cause of death, but now chronic diseases such as heart disease and cancer are the main risk factors for health. Among the American Indian population, heart disease is the leading cause of death. Heart disease among the American Indian population was, in the past, 21% lower than the total US population during the 1970s. And by the late 1990s, they were 20% higher than the total US population. So we have seen a significant shift within heart disease and the American Indian population. And they also tend to die at a younger age from heart disease compared to any other ethnic group in America. In the American Indian population, we see 12.7% have heart disease, 7.2% have coronary heart disease, 25.8% suffer from hypertension, and 4.6% have had a stroke in the past. And this map shows us the heart disease death rates of American Indians and Alaska Natives 35 years and older. So over the past 50 years, the shift within this culture has consisted of less physical activity, a change in their diet, and more of the population smoking, which we know are all risk factors for heart disease. American Indians are 2.3 times more likely to be diabetic, and their youth are 9 times more likely to be diagnosed with type 2 diabetes compared to non-Hispanic whites. From 1990 to 2009, there was a 110% increase in American Indians and Alaskan Natives to be diagnosed with diabetes. 27.6% of the American Indian population are overweight or obese, and only 17% of American Indian adults meet the physical activity guidelines. The Center for Disease Control and Prevention reports that 43.8% of American Indians and Alaskan Natives adults reported current use of commercial tobacco in 2013. So this is smoking, chewing, which all are risk factors for heart disease. Now, in its natural form, tobacco is seen sacred and used traditionally within the American Indian population. But today, tobacco now is mixed with chemical additives, taking away from its original purpose. And unfortunately, this is now the most common use of tobacco and is used more in this population than all other ethnic groups for both youth and adults of American Indians. So what can we do to combat heart disease within American Indians? There is the Indian Health Services, which is a part of the Department of Health and Human Services, and they specifically serve the American Indian and Alaska Native population. The Indian Health Services is a federally funded healthcare program for the American Indian population that works with tribal members to properly and efficiently serve this population. Their mission is to raise the physical, mental, social, and spiritual health by working with individual tribes by providing health programs to the community. Offered by the Indian Health Services is the Special Diabetes Program for Indians, and they have a Healthy Heart Project that helps to reduce the prevalence of heart disease within the American Indian population. The Healthy Heart Project's goals is to reduce the risk of cardiovascular disease in American Indians with diabetes by controlling risk factors such as blood pressure, cholesterol, poor diet, and smoking to reduce this occurrence of heart disease. This program has been successful due to the incorporation of community and culture within the program. In the beginning, tribal leaders were part of the program, and because of their success in the program, this encouraged community members to be involved as well. They took into consideration the culture when setting up the program, and appointments with individual clients were set up every 30 to 60 minutes. Now, this ensured a connection and respect of time with the patient and case manager. They weren't just in and out of the room seeing them for 5 minutes, but they actually sat with each patient individually and went through their personal issues, which they were provided a safe space for, so patients weren't afraid to share what they were going through because they had a safe space and connection with their case manager. And they also included culturally appropriate activities. So they had community gatherings that conducted nature walks. They did traditional weaving and started community gardens. And so they took into consideration the things that this culture and community was already doing or did in the past and incorporated that as part of the program. And following this intervention, they saw improvements in all of these categories. Fewer participants were smoking, they were eating healthier foods, eating less junk food, and participating in physical activity regularly. So what future approaches can be done within this community? Gaining the trust and support of the American Indian community is key when working with this population. And we know when working with any ethnic group, taking into consideration their cultural beliefs, values, traditions, and practices is very important. What may be accepted in one culture can be viewed as disrespectful or unacceptable in another. So understanding the culture within the healthcare system is important in creating that healthy community. With the American Indians, gaining support of the community is important, but most importantly, gaining the support of their tribal leaders is important and can help to gain that communal support. By educating public health officials on the values, beliefs, and traditions of the American Indian culture can help to gain that respect, trust, and support. Taking advantage of things like the Indian Health Services can help better bridge this gap between public health and the American Indian community. Another improvement that needs to be made with public health and the American Indian population is data collection. In the past, it has been recorded inaccurately because some American Indians are misreported as white, especially when living off reservations. So data has been adjusted for the misreporting, but it is still not accurate as for other populations. Having more accurate data can help public officials to better serve and understand the health needs within the American Indian population. And lastly, providing affordable and accessible healthcare for American Indians is important. The Indian Health Services operates on a budget of about $3 billion, a little under $3 billion, to pay for care for a service population of 1.5 million of the 4.1 million people who identify themselves as American Indian. So providing more funding for American Indian healthcare could potentially make strides in closing the gap in health disparities for this population. Thank you.